you tell me when you're gonna. Good evening, everybody. Just a little bit of a surprise. I arrived to Turkey on the 18th of July with Fiona, and along with another 12 of us. And since then, Fiona has been here, had her surgery, and came to Marmaris, stayed here for 4 weeks, gone back home to Scotland, and came back again here. So I am just due to fly back home for a couple of days to sort stuff out. But I thought in passing, I'll pop in to see how she is doing. I can't believe you're looking so fabulous.
Thank you.
I knew you were doing well anyway, but we kept touch. But just wanted to see what life has been about, and how did you get on?
Yeah.
And
okay. So first of all, here's our dinner coming. So as an example of what I'm eating now,
exactly,
compared to what everybody else is eating.
Exactly.
So I'm having the garlic shrimps.
Garlic shrimps.
That's here.
Myself here. So
this is actually quite good.
Yeah.
Because we're all having proper food, and obviously she's having proper food.
And I'm not missing out on anything at all.
And you're not, are you?
No, I don't feel as though I'm missing out. So
that was one of the first questions that I asked. How do you actually find yourself coping with being able to go out and socialising?
Yep.
Okay, obviously you've been here all this time. Do you feel like you've been left out, or
not at all?
Do you feel hungry, or looking at other people's food and go, "Oh my God, that's what I want to eat"?
Not at all. So I'm looking at the moment, and I can see 2 pasta dishes opposite me.
Show the pasta dishes,
which are quite appetising.
We haven't got a line, but that's a pasta dish.
Yeah. So
that's a pasta dish.
Yeah.
And
I'm having
a pasta dish.
No. So I've selected today, and it's quite a big portion, but it's a starter, and it's garlic shrimps. Because obviously carbohydrates, pastas, rices, and everything are something I'm not eating any longer. So I'm not missing out because I quite like prawns, shrimps, and I like garlic as well, and it's not too rich. Now I'll possibly eat maybe 6 of these if I'm lucky, but I don't feel as though I'm missing out because it's something I enjoy eating. It's something that looks appetising, it smells delicious, and I can sit and talk and eat along with everybody else at the same time.
The one thing you said though, you're dying to have a drink, but you haven't been able to drink your water yet.
So I'm sitting with my full glass of water whilst everybody else has quenched their thirst, because I've been waiting on the food to come in and wait my half hour before I have my drink, and I'll have my half hour after.
So it's been 8 weeks obviously since your surgery, and you're obviously now back onto eating normal food, and it will be another obviously a few weeks, couple of more months you introducing your alcohol and everything else. And you haven't touched alcohol.
No, I haven't. I gave you my wine earlier.
I know. I had a glass. I did. I had a glass earlier, so I quite enjoyed it. But just to join you, I'm having water with my dinner. So, is there anything that you would actually kind of tell people that who's coming out for surgery tomorrow?
Yep.
What is it that the main thing that they should kind of consider?
Yep. So I would advise anybody to follow the advice that they've been given. So initially you'll get advice about the pre-op diet, and it does say it's not compulsory. However, I would say stick to it best you can, as close as you can to it. It will help you after the surgery because that's when you'll feel pain and things. So try and stick to that, and follow the advice given by the nutritionist and your surgeon thereafter. Everybody has an opinion and everybody has their view, and it's all right to ask questions, but check up on your notes. Check the history, check what you can eat, when you can eat it, and just follow it the best you can. I've been quite strict in trying to follow it, and I have had no pain at all whatsoever.
Can I ask you a question, Fiona? For people, you see comments from lots of people about they're thinking about it, they're researching into it, and they're still unsure about it. I mean, based on your experience, what would you say to people who are thinking about a sleeve?
Okay, I would say do the right thing, you're doing your research, but mentally prepare yourself for this change. It's a change in your lifestyle, and you have to mentally have yourself prepared that once I've done this, I'm going to change the way I'm eating, I'm going to change the way I'm thinking about food. And it's not that you can't ever have anything again, it's that you'll have reduced portion sizes, you might have less of it, but you have to educate yourself and prepare yourself. So for example, I started preparing myself way back sort of February, March time for my surgery. Okay, lockdown had a bit of an impact, but I started preparing by cutting out Diet Pepsi, which I drank by an abundance. But I started, that was one process, which meant then I didn't have headaches straight after surgery because I wasn't having a quick withdrawal.
Right.
Right. I didn't realise till you said it before, actually, I didn't realise that it had an effect on your well-being as far as the headaches goes, because lots of people actually do complain. You know, in the last 8 weeks since you've gone, I've been in and out of that hospital and seeing pretty much everybody after their surgeries. That is, headaches is one of the main.
It could be caffeine, you know, with coffee or things as well. It doesn't have to be, you know, fizzy juice. It could come from coffee or anything.
Okay.
So,
all right.
So preparation.
What was it? Preparation.
Yeah.
Very good. Well, thank you very much for watching, and thank you very much for
Good luck,
having me.
everybody.
Thank you, Fiona.
And
Yes.
thank you very much for having me here, just for a quick visit. But I could have
Enjoy.
missed the opportunity, but when I seen the place we had the kebab before your surgery, so I thought I'm going in to still say hello. Thank you.
Yeah, all right. Good luck, everybody.
Good night. Bye.
Bye.
What?